Hey y'all, I'm Tiffany with Microharmony. I'm not only a pelvic health educator, but I also have treated pelvic floor patients for many years now. I've actually had personal experience with being a pelvic health patient for treating my own personal pelvic pain. I received this 10-piece vaginal dilator set from VWell, and I'm about to tell you my first impressions of this dilator set and compare them to the 5-piece sets. But before we start, let's talk about why someone would need vaginal dilators. Well, if you experience pelvic pain, vaginismus, which is the involuntary tensing of the pelvic floor muscles, which make pain with intercourse, whether it be initial or deeper penetration, the inability to insert a tampon or tolerate pelvic exams. Vaginal dilators actually aid in making permanent gradual changes to the vaginal tissue to decrease pain. It also aids in decreasing pelvic floor muscle spasm that aids in post-surgical or post-radiation therapy to make vaginal tissue elasticity and prevent scarring or adhesion. These dilators are made of medical grade silicone. They are paraben free, body safe, so you need to use a water-based lubricant when you are using these. If you look in the description section, you will find a link to my live webinars. I have a vaginal dilator webinar where I go into much more detail about the various diagnoses, how to choose the best dilator set for you, and how to actually progress dilators and return to intercourse. Check the description section. I update the times often, and I'm open to adding additional times should they not really fit in with your schedule. So on to the dilator. So this is the 10-piece set. I'm already removed the cellophane just so I can actually take a good look at this. Let's see. So you get the usual instructions, the bag for discretion, because goodness knows that you don't want your children to walk in and find these just kind of hanging out. You want to have them kind of tucked away somewhere. That would be devastating. Anyway, so this one has 10 pieces as you see here. So they have a 5-piece set and an additional 3-piece for larger sizes, but this set actually encompasses all of these 5 pieces, but with additional to progress from 1, which is this one right here on this set, 1 all the way to 5, but there's actually 10. All right, so I just opened the box and I just laid them out just so you can actually see them. So as you know, I've done the review on the 5-piece set, but let's talk about how they're different. So if you look at number 1, this is number 1 on the 5-piece set, and you have 2 smaller ones. Why do I love this? A lot of my clients that have vaginismus, they really struggle with that initial penetration. Some can't even insert a tampon. So this progression, this number 1, and I'm gonna put a video next to me so you can see this, but it is the size of my finger. So the fact that they have 2 below that size, and you can see the length difference as well as the diameter difference. Y'all, this is a huge deal because as you can see, the height of these, let me put them right next to each other so you can see the height progression here. Why is that so important? As you are making, inserting into the vaginal opening, you are making those changes. The vaginal canal, especially when you have the tension or say post-op transitions, hormonal changes where the vaginal canal can be very, very, very fragile, almost like tissue paper. If you wet tissue paper and you try to pull a tissue paper apart, it's very, very fragile. So these smaller dilators really pave the way so that you can progress appropriately without that increase of pain. A lot of people had a complaint from number 4 to 5 whenever I was looking at the reviews of this 5-piece set, but I definitely think the gradual progression of this set will make this transition much easier. And I will say in my webinar, I will talk in great detail about how to actually progress from here to here throughout the whole set with more ease, less anxiety, and all of those things. The dilators actually have a suction base. So some people are like, well, why do you need that? Well, not only as you're progressing with internal use of these dilators, sometimes setting it on a flat surface and sitting is a good progression to kind of almost as a functional movement, having it in that position. But the reason I personally really like the suction bottoms is it gives you an elongation of the dilator. So when you're lying flat and you're trying to reach, if you're just trying to hold here, it's a lot more difficult. This gives you a handle and more flexibility to insert as well as make dynamic stretches inside the vaginal canal. Think about stretching in the back portion and things like that. So I really love that. You heard that pop? So I really love that option. I will say texture-wise, it's a very smooth silicone. I think it'll be very, very comfortable. I do not think the smaller sizes will be great for dynamic stretching, as they are rather flimsy. But as you progress to the larger, they get to be a lot less flimsy, but they maintain the integrity of the dilator so that you'll be able to make more dynamic stretches with the larger. So make sure you check the description section, and I will have a link. If you look right here, use My Core Harmony, you will get 15% off your entire order. VWell has not only vaginal dilators, but they have from lubricants to cleaning. But check the description section for the link to purchase should you want to try these. And if you're still trying to decide, check out my webinar. I will talk again about these, but I'll also go into detail about some other ones so you can make the best decision for yourself. Again, dilators are not a one size fits all, but I will say these two sets were great. I thought this set was great, but this is a really great transition with more options for you to make those progressions and not be so aggressive with the progressions. Does that make sense? So I hope to see y'all at my webinars. Don't forget to comment below if you have any questions, and so don't forget to follow me for more tips and tricks as well as pelvic floor education. Y'all take care. Bye, y'all.